But now let's talk about boosters. Job one is always to get folks who have not even had a single dose. That's always going to be our first strategic imperative. But the boosters are really important, and obviously on Thursday night, we got what we were waiting for, the formal approval from the CDC. And starting Friday morning, this city was ready and already administering boosters in our city-run sites. So far, since the booster effort began, with the previous announcements that we received from the CDC, there have been almost 227,000 booster doses given in New York City. So people have embraced this, and what they found is it's very easy to get that booster. It's easy to schedule an appointment. There's obviously a lot of places you can walk in as well. If you want to find sites, go to vaccinefinder.nyc.gov. So here's my message to all New Yorkers: get that booster. It's good for you. It keeps you safe, keeps your family safe. It's ready, it's here, it's now. Go get it. Now let's hear from our doctor, who's going to tell us the latest, Dr. Dave Chokshi.
Thank you so much, Mr. Mayor. Throughout the pandemic, we've been here to give New Yorkers the latest scientific developments regarding COVID-19 so that we can work together as a city to fight the coronavirus. Last week's vaccine news means that even more of the most at-risk New Yorkers can get an added layer of protection. But figuring out if you're eligible for a booster dose and which one to get, it can be a little confusing. So let me try to break it down for New Yorkers. First, the science continues to show that all three of the authorized COVID-19 vaccines are safe and highly effective at saving lives and preventing suffering. That's why getting more New Yorkers fully vaccinated remains our top priority. Second, booster doses are now available across all three vaccine types: Pfizer, Moderna, and Johnson & Johnson, and mixing and matching of vaccines is permitted. Third, anyone who received the single-dose Johnson & Johnson vaccine at least 2 months ago, like the mayor and I did, should get a booster shot. It can be any of the three vaccine types, and while the science is not settled about which booster is best, some evidence suggests that a Moderna or Pfizer booster could produce higher antibody levels than a second dose of J&J. Fourth, you are also eligible for a booster if you receive Moderna or Pfizer at least 6 months ago and are in one of these categories. If you're a senior that's 65 years and older, if you're an adult with underlying medical conditions, for example, diabetes, or an adult at higher risk of COVID-19 exposure, like a healthcare worker, a first responder, or a nursing home resident. If you receive 2 shots of the Pfizer or Moderna vaccine, the science that we have suggests getting the same vaccine for your booster, but you have the choice to switch to any of the other vaccine types. Finally, if you're not sure which booster is right for you, you can consult with your doctor, clinical staff at one of the city's hundreds of vaccination sites, or visit us at nyc.gov/COVID-vaccine to learn more. And remember, while boosters are good news for individuals and for our city, first doses remain even more important than third doses. If you know someone who remains unvaccinated, please reach out to them, share your story, and encourage them to join the over 6 million New Yorkers who are moving our city forward. Thank you so much, sir.
Thank you very much, Dr. Chokshi. Thank you to you and all your colleagues for getting us ready. And everyone, look, Dr. Chokshi is making it really clear to everyone. New Yorkers, if you're eligible, go out and get that booster, and you can mix and match. So I'm an example. Like Dave, I got Johnson & Johnson, and now I will lead by example. It's time for a booster. And the advice I've received is, in this case, as a Johnson & Johnson recipient, the best alternative for the booster is Moderna. That's based on the latest research. I'm pulling the sleeve up, as Dave has told me to, very, very high.
That's right.
I'm going to hold it up, Dave. Give me a boost, Dave.
You know the drill. We have some practice with this.
We have done this very successfully before. I'm putting my shoulder where my mouth is. Now, wait a minute. That doesn't make sense. We always try and come up with something unscripted here.
Well, this does give me a chance to say that everyone can also get the vaccine in the comfort of their own home.
That's right.
nyc.gov/home vaccine.
That is a damn good point. An amazing, amazing service this city provides.
All right, sir. 3, 2, 1.
At some point, Dave will administer the Moderna booster. I know it's live TV, and you know these precious seconds are passing by. Dave, when are we going to do this?
We are all done, sir.
What? I'm shocked.
I'll just give you your Band-Aid.
Well done. This guy really, really very subtle shot giver. Thank you, Dave. You're a man of many, many skills.
You got it, sir.
Well done. All right.